Cheryl, as President of CalTCM, speaking to one of the most effective long-term care physician leaders in the country over decades, what is our role in driving improvement in long-term care, and what have we done right and wrong, and what can we do better in the future?
So first of all, I think it's worthwhile stepping back and saying what powerful influences CalTCM already has. Areas of antipsychotic oversight, areas of looking at advanced care planning and post, for instance. Those are two, I think, and I could list dozens more, of where the policy, the clinical leadership, and the voice pulled together, which sometimes can lead to much better legislation that affects thousands and thousands. Where I think our opportunity is, and I never want to say what we have done wrong, but I think oftentimes, particularly we physicians, think of advocacy as what somebody else does or what somebody does on the Hill. We are the advocates. So whether we're paying attention to state and regulatory oversight, whether we're participating in dialogue with federal policy, we become that voice of, if you do this, this will happen, because we understand that intersection. And I think that we haven't done that enough, and our opportunity is to engage our membership more powerfully with that voice, because we really are the leaders that are going to make the changes that make it better.
And we are. There are no other physician leaders that are in long-term care to provide, and not just physician, interdisciplinary
Absolutely.
leaders, which is our driving. I think when I was at AMDA, what we are doing and we need to do more of is being an interdisciplinary leader. I think AMDA's following us, but CalTCM led the way in including physicians, nurse practitioners, nurses, pharmacists, social workers.
And actually my mention of physicians was more of a criticism, because I think many of the interdisciplinary professionals have already grasped this and are already doing a really good job of advocacy. Sometimes physicians think that's what somebody else will do. So when I'm thinking of advocacy, it truly is all of us as leaders, and what a profound role. And you're right, I think that CalTCM has been in many ways a national leader in lots of areas, including our own state legislative policy.
Right. And I do believe AMDA is following us in allowing and encouraging other disciplines to become full members, which has been our policy for well over a decade.
As goes California, yes.
Now you're doing many other things, and I just thought you're working with Advancing Excellence. You're really looking at, from leading age's perspective, at the new dynamics of accountable care organizations. What can CalTCM do to leverage these other resources to drive quality in long-term care?
And I'm hearing so much of it at this meeting, so anybody who's not at the meeting, you've missed some good things. But the point that I think ties all that together is we in long-term care should not be the afterthought in healthcare reform, in accountable care organizations, in bundled payment. But sadly, the systems that are driving it right now don't go to think of us first. We have the opportunity to not wait to be the lowest purchase vendor in a contracted payment scheme, but be the solution. When you think of the Medicare cost curve, there is no greater touch point right now than the whole post-acute continuum. Furthermore, I think that the real power, if I'm talking about accountable care organization, I don't want to talk about avoiding hospital readmissions. I want to talk about not post-acute, but instead of acute.
Right.
Where are we looking to really impact, whether it's at affordable housing and services, integrating home and community-based care, improving the quality in nursing home settings, linking communications across the continuum? We have that power to do that, and there is not a better place to influence that than with CalTCM.
Well, you are the great leader. We will do this. We are in CalTCM. We are going to focus on person-centered care, and we will be mindful that the most expensive and the most vulnerable patients who have the greatest opportunity for improvement by bringing together a team focused on really delivering the right care at the right place at the right time by professionals working together in a team is CalTCM. So please, if you're seeing this video of this conversation, please join us, because we will be driving the future of healthcare.
Absolutely. Thank you.